Hello, I'm Mary Gavoni of Mary Gavoni and Associates. The video you're about to watch is information about the latest updates to the CDC guidance for dental settings during the COVID-19 pandemic. These guidelines were updated August 4th, 2020, and the information in this video is current as of August 10th, 2020. Keep in mind that this information can change frequently. At the end of the presentation, there will be information for you to ask questions and to have your questions answered. I hope you find the information helpful. The CDC issued its first interim guidance for dental settings in April of this year. There have been 3 updates since, the most recent of which was August 4th, and that is what we're going to focus on in this video. What are the changes to the documents? The documents are not completely changed each time there's an update, but as new information is learned about the virus and how it's transmitted and how we need to protect ourselves, the CDC then will update the document, highlight what the changes are, and let us know what it is that we need to do to protect our patients and to protect ourselves. This is the link to those documents. As I mentioned earlier, in the dental settings interim guidance from the CDC, there are numerous links to other sets of guidance documents, which can be a little confusing, but I've tried to simplify it here for you to the ones I think that are the most critical for every dental practice to know, and this is one of them, the framework for healthcare systems providing non-COVID clinical care during the COVID pandemic. And that is exactly what we are doing. We're providing treatment that's not related to COVID-19 disease, and we're still in the middle of the pandemic. So this is the link to that document that I believe every dental practice needs to be familiar with. This is another set of interim infection prevention guidelines for all of healthcare that is referenced in the dental interim guidance. And this is a document that supports the use of PPE and what types and when, and we'll talk about the new recommendation for eyewear. Here is the Cliff Notes version of the summary of changes from the CDC in the dental interim guidance. The most significant of which, in my opinion, is that they now have separated the guidance into 2 distinct sections. The first being the infection prevention and control practices for routine dental care during the pandemic, and the second section being recommended practices when providing care for patients with suspected or confirmed infections. Now, the second group of patients would be those that we only provide emergency treatment for, and we've known what that guidance is all along. So we're going to emphasize the changes in the first section, which is prevention of infection in routine dental care, those patients that we do not suspect have a COVID infection. And there are 3 key points. One is an updated definition of fever, which may seem a little minor, but it's some good clarification, I think, for us. Some revised PPE recommendations and guidance on physical distancing. And this has become a challenge in some practices for employees in a break room. But that we base our treatment on a patient assessment. Is there a risk to the patient because maybe they have some underlying conditions that could make them more susceptible to a COVID infection? And are there employees with underlying conditions that may make them more susceptible? So that's something to consider. The biggest thing is, do we have enough PPE and other supplies? Just because N95s have been hard to get doesn't mean that it's always okay to treat patients wearing a level 3 mask and a face shield doing lots of aerosol producing procedures when that may not afford us the best protection possible. And so we also may see even shortages again of even level 3 masks. And we're hearing rumors of shortages of gloves. And what about disinfectants? So if we don't have the appropriate supplies, we may not be able to adequately treat patients. And so you need to stay in touch with your local health departments and other agencies that tell you what is the prevalence of COVID-19 disease in your area. And if the disease rates are high, then perhaps some of your patients shouldn't be receiving treatment now. It is not business as usual. We are still in the middle of the pandemic. And the CDC has repeated many times the recommendation about, of course, using teledentistry. Can we prevent those in-person visits to assess a patient? And of course, making sure that everyone is following those pre-treatment triage protocols and letting patients know that they shouldn't come in. They need to let us know if they have any respiratory symptoms. I think we've gotten pretty good at that. There still are some patients that will come in that object to wearing a face mask when they come in the office, and we need to stand firm with those patients and say, we are following CDC protocols. If you're in a state where there is an actual law that says indoors people must wear face masks, then you have to tell them we're following the state law and we're sorry that you choose not to comply, but you can't be here without a face mask. And we also need to continue monitoring and managing the dental healthcare personnel, meaning stay home if you're sick. If you feel feverish, if you have some respiratory symptoms, then tell your employer ahead of time. Don't show up to be assessed, just stay home. The CDC has clarified slightly the definition of a fever as it's used for a screening tool for a possible COVID-19 infection. Every dental practice should be taking patients' temperatures every time they come in. The same thing for employees. They should have their temperature screened at the beginning of every workday. If a patient has a temperature of 100 degrees Fahrenheit or more, and previously it was 100.4, so we've downsized, so to speak, the definition, but also consider that if the patient has a fever and they don't have any other symptoms of COVID infection, loss of taste and smell, respiratory symptoms, some diarrhea or other of the symptoms that are attributed to COVID, they may have a fever because they have a dental infection. If they're coming to you because they have some pain or swelling, that may be causing a fever for them, and it doesn't mean in the absence of any other symptoms that you can't see them because they have a fever. Does the patient have some other underlying kind of infection? So we need to know that. We need to use the fever and the temperature screening as one of the tools in the toolbox, but if the temperature's over 100, then what do we look for? Other symptoms of COVID or other types of non-COVID infections. One of the recommendations that I think is very, very important in our updated guidance from CDC is that every practice, every facility needs to create a process to respond to SARS-CoV-2 or COVID-19 exposures among dental healthcare personnel and others, meaning patients or our families for that matter. So one of the things that the CDC clarified for us in a previous set of documents and has reiterated again is that we make sure that we request that patients contact us if they develop signs or symptoms of COVID-19 or are diagnosed with COVID-19, meaning they test positive within 2 days following their appointment. In previous guidance, we were taught to monitor patients for 14 days. Now the CDC is saying 2 days. the window of time closed down because of different issues with the potential for infectiousness, but really and truly, it's to hone in on contact tracing as soon as possible to make sure that we are able to contain the possible spread of an infection. Now, I'm getting lots and lots of questions about what do we do if somebody is exposed at work. So we find out that the hygiene patient that was treated in the practice 2 days ago now has COVID-19. And what about the hygienist that treated that patient? What about the doctor who did a hygiene evaluation on that patient? And what about everyone else in the practice? So the CDC has another set of interim guidance that addresses what are the risk assessments and what are the work restrictions for healthcare personnel. And this is the link to that document. So this is what every dental practice needs to have on hand to know what to do. And this is done also in conjunction with the local health department, that if you have questions beyond this document, you can contact your local health department to find out what their recommendation is for contact tracing. This chart, which comes from the CDC document that we mentioned previously, is a great tool for practices to refer to if there is an exposure. And what do we do for the employee? Do they need to be excluded from work? Do they need to be tested? Does everybody in the office need to be tested? And so forth. And it's based on whether or not you have been wearing the appropriate PPE during an aerosol generating procedure. So in the CDC definition of prolonged close contact, that means any aerosol generating procedure, regardless of the time frame, at close contact without PPE is considered to be a risk of exposure. So if someone was treating a patient, not wearing a face mask or respirator, not wearing eye protection, and not wearing gloves, gown, all of the other types of PPE that are required, then that could be considered a risk, and they should be excluded from work for 14 days, and they of course need to monitor themselves for symptoms and seek medical care if they do develop symptoms of COVID-19. If personnel in the practice were wearing appropriate PPE, even if they were doing an aerosol generating procedure, there is no requirement, no recommendation for work restrictions. They certainly should monitor themselves for possible symptoms, but there isn't a recommendation for blanket testing of everyone because we found out that a patient was in 2 days ago and had COVID-19 or tested positive for COVID-19. As long as we were wearing our PPE as prescribed, there is not a work restriction and there is not a need for testing. And speaking of testing for COVID-19, dental healthcare personnel should be tested certainly if they have signs or symptoms that are consistent with COVID-19. And anyone who is asymptomatic but may have had a known or suspected exposure. And that could be at the office without the appropriate PPE in place, or it could be what's called a community exposure, which would be outside of work, perhaps in a family situation or in some kind of a social setting, a bar or restaurant, something of that nature, where there has been an outbreak. So those would be justification for testing. Routine testing without signs or symptoms or potential exposure just isn't done because of the unavailability of testing in many areas. So this is the link to the testing guidance from CDC for healthcare personnel. Again, I think this is a great document for practices to review, to be familiar with and have a good understanding about testing protocol. There has been a change, a pretty significant change, however, in the recommendations from CDC about returning to work for healthcare workers who have had symptoms or a diagnosis of COVID-19. In most cases, test-based strategies, meaning someone has 2 or 3 negative COVID-19 tests before they return to work, is no longer recommended, except for someone who has a severe underlying condition or they are severely immune compromised. And then they need to be excluded from work for 20 days, so beyond the 14 days, and certainly working in close alliance with their healthcare provider to make sure that it is safe for them to return to work for their potential for re-exposure. So what the criteria are now for returning to work after someone has had COVID and is in a healthcare setting is based on symptoms. So according to the CDC, they have now changed the recommendation from 72 to 24 hours as the time that must have passed since that healthcare worker had the last fever noted without the use of any kind of fever-reducing medications. Then we also look at when have symptoms improved, and not just respiratory symptoms, but all symptoms of COVID-19, including the loss of taste and smell and so forth. So again, I encourage you to go and read this document so that you have a better understanding and you have something to refer back to know what to do for when an employee is safe to return to work, but also make sure that the employee is following advice from their primary care physician. In a few minutes, I will go over the change recommended by the CDC for personal protective equipment for dental health care providers. But I first want to take a moment to review this concept of universal source control that we've been introduced to by the CDC. And that is that we should be wearing a face covering at all times when we're in the dental practice. And this is also the same principle that public health officials recommend for people who are out in restaurants and shops and so forth to protect from the spread of droplets or respiratory secretions from people who may be infectious. In particular, individuals who are asymptomatic. They don't even know they're infectious, and they could spread the droplets when they're talking, sneezing, or coughing. Now, obviously, in a restaurant, you cannot wear the face mask and eat at the same time, but you are required by law in many states to have that face covering on when you walk into the restaurant, and you keep it on until your food comes, and then you put it back on after you eat. And this is sort of the same concept that we practice in our dental practices. Patients must wear a face covering into the office, and they take it off for treatment, and they put it back on when they leave the office. And for the dental team members, they should be coming into the office at the beginning of the day with a face covering on, so they're protecting the person who's scanning them, temperature scanning them from potential droplet exposure. And that can be simply a mask, level 1, level 2 mask, or a cloth face covering. That's fine. And when not performing patient care duties. But when you are performing direct patient care, CDC recommendation is N95 respirator or higher when performing aerosol generating procedures, a level 3 mask with a full face shield when performing non-aerosol generating procedures. And a lot of people are complaining about how warm they get, how uncomfortable the N95 respirators can be. And so you need to know that you don't have to have that N95 respirator on all day long. You can take a break from it as long as you replace it with another type of face covering when you're doing non-patient care functions. Some additional PPE recommendations that are contained in the interim guidance include not using respirators with exhalation valves, because if a dental team member happened to be COVID positive perhaps asymptomatic, didn't know, that exhalation valve could allow some droplets to be expelled out of that mask. So many people like the exhalation valve because it makes it easier to breathe in a respirator, but they're not appropriate in dental healthcare settings. The other recommendation that was very much on the news in the last week, and you may have heard Dr. Deborah Birx make this recommendation about using protective eyewear at all times to protect the mucous membranes of the eyes. So in addition to, as we talked previously, universal source control, wearing a mask at all times while we're in the practice, eye protection is considered just as important, because even being in the presence of someone who may be infectious, if they're talking, you are certainly protecting your nose and your mouth from the droplets, but your eyes may not be protected. So a face shield, goggles are appropriate, but personal eyeglasses or eyewear are not considered sufficient because they don't seal around the face. And also remember that you need to follow the CDC recommendations for donning and doffing, putting on, taking off your PPE. And this is a link to those recommendations from the CDC. Next, I'm going to share with you my top takeaways from the CDC interim guidance and some tips on how to best implement them in your practice to make it successful for you, to create the safest environment for your patients and the safest work environment for you. Carefully read the latest recommendations for dental settings. I would say that document should be read over at least 2 times so that you really understand and you haven't missed something on the first review. Go to all the linked documents within that guidance to make sure that you understand why things are being recommended. Keep those documents on hand. I don't know that you need to print them all, but certainly download an electronic copy and save it. Develop a written policy and protocol based on the guidelines. What are we going to do to screen our patients? What are we doing for screening employees? What's the protocol that we need to follow if we have a potential exposure to COVID within our practice? And whatever, especially the infection prevention protocols that you use in your treatment rooms and working with patients are based on guidelines from CDC and science. There are a lot of informational videos and webinars that have been presented about doing all kinds of things to disinfect, decontaminate face masks and so forth. Make sure that it is something that has been scientifically proven and or approved or cleared through the Food and Drug Administration, because there could be some potential liability to a practice if a patient, for example, contracted COVID or alleged that they contracted COVID and a practice wasn't following something that was truly supported by the science. And remember that we're still in the middle of a pandemic. We hate some of the things we have to do. Most people hate wearing N95 respirators, and we hate having to change a gown after every patient, but it is for our protection, it is for the protection of our families, and it is for the protection of our patients. Again, I hope you found this information helpful, and I also hope that you will allow us the opportunity to continue to keep you updated on developments that affect us in dentistry, whether it's infection prevention and control, OSHA compliance, HIPAA compliance, or other pertinent information that you need to be aware of. You can subscribe to our YouTube channel, and in the next weeks and months, we will be continuing to upload more videos that are instructional and can be used for team training. They can be used to update and keep you informed about new developments in dentistry. We also
provide a complimentary electronic compliance newsletter, and you can access that on our website, marygavoni.com. And we cover, again, HIPAA, OSHA compliance, infection prevention, and any other regulatory or pertinent info that you need to be aware of to make sure that you are practicing safely and in compliance with all the regulations that affect you. And the last thing I want to let you know is that we have updated our very popular COVID-19 resources manual with all kinds of new information, research articles, studies, guidelines, OSHA compliance documents, and so forth. And it's available to you on our website. There's an icon you can click on the website. If you use the coupon code video in the checkout process, you will receive a $29 discount. The normal price is $39. You will receive it for $10. And that certainly saves you time and energy of having to go out and research all this information and collect it on your own. So we hope that you find that helpful as well. So thank you again for watching, and we hope to see you again here soon.